602, according to the state. That's how many babies died before their first birthday in Indiana in 2016. Today, healthcare leaders met to talk about concrete ways to combat infant mortality in Indiana. State House Bureau Chief David Williams reports.
Almost 3,000 infants have died in the last 5 years. That's sadly enough babies to fill almost 42 school buses.
It's not fair for our babies to die before their first birthday.
That's the reason Community Health Networks and Indiana's Department of Health are leading this year's Infant Mortality Summit. They're talking, learning, and sharing real ways to keep more babies and moms alive. 25% of Black Indiana babies died from sudden unexpected infant death syndrome in 2016, which is why safe infant sleep is one of the topics.
Alone on their back in a crib. ABC's very simple. No blankets, no bumper pads, no cute stuffed animals, no sleeping with children or parents.
Data shows Indiana's 2017 infant mortality rate fell slightly to 7.3 per 1,000 live births. We have the highest rate compared to 7 other Midwest states.
We're seeing slow declines in infant mortality amongst white babies, but we're seeing an increase amongst Black babies.
That rate jumped to 15.3 per 1,000 live births in 2017. Why? Dr. Indy Lane says it's complicated, but high-risk conditions like hypertension, diabetes, and other barriers impact babies.
I think that in communities of color, there are sometimes lack of resources. There is a clear mistrust of the healthcare industry and healthcare professionals. I think that as healthcare professionals, we need to do a better job of understanding cultural differences and racial differences and some of the implicit biases that we just naturally have.
State officials are touring the state to promote the new OB Navigator program, which will work to break those barriers and connect pregnant women in high-risk areas to a health-based worker. All of it has lawmakers' attention.
We had to understand how to engage mothers in regards to their children to get them to year 1 and beyond.
So some people tell me after today they plan to go back and sift through what they've learned here and put some things into practice. I'm David Williams, Fish TV, News 8.